Which of the following behaviors would be under the category grimace in the Apgar score? A. Coughing. B. Pulling away. C. Sneezing. D. All of these. The answer is D. All of these. The grimace category of the Apgar score actually refers to a wide variety of reflexive behavior. These include sneezing and coughing, crying on stimulation, pulling away, and facial expression. At what time after birth is the Apgar score calculated? A. At 1 minute only. B. At 1, 5, and 10 minutes. C. At 1 and 5 minutes. D. At 5 minutes only. The answer is C. At 1 and 5 minutes. The Apgar score is calculated 1 minute after birth, and then again at 5 minutes after birth. It is common for infants to be born with depressed respiration, cyanosis, and other physical signs of struggle that are quickly resolved within 5 minutes after birth. If signs of respiratory or cardiovascular distress do not improve by this time, however, emergency intervention may be required. You have just calculated a newborn's 5-minute Apgar score as 5. What is the proper response? A. Do nothing, this is a normal score. B. Emergency intervention, this is a severely depressed score. C. Do nothing, this is a perfect score. D. Monitor closely, this is a moderately depressed score. The answer is D. Monitor closely, this is a moderately depressed score. The Apgar scale goes from 0 to 10. A score of 0 to 3 would indicate severe depression of function, 4 to 6 would indicate moderate depression, and 7 to 10 would be a normal, healthy score. In the case of moderate depression, the newborn should be monitored closely. Immediate emergency intervention may not be required, as healthy neonates can have moderately low Apgar score indicators that improve in the first few hours of life. What is a normal heart rate for a newborn 2 hours postpartum? A. 110 to 160 beats per minute. B. 60 to 90 beats per minute. C. 140 to 190 beats per minute. D. 80 to 110 beats per minute. The answer is A. 110 to 160 beats per minute. A newborn's heart rate is significantly higher than that of an adult. Normal heart rate for a newborn 2 hours postpartum is 110 to 160 beats per minute. Heart rate decreases in the first year of life to 80-140 beats per minute. A nurse assists in the delivery of a healthy 7 pounds, 4 ounces infant. 6 days later the parents call the clinic with some concern. They state that their daughter has begun to lose weight. She has lost nearly 10 ounces since birth, despite breastfeeding regularly. How should the nurse counsel this couple? A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. B. This is an emergency. The couple should bring their infant to the emergency department. C. This is not normal but not yet a cause for concern. D. This is abnormal and cause for serious concern. The answer is A. This is normal. A breastfed baby will generally lose 5 to 10% of their birth weight in the first week of life. It is normal for infants to lose 5 to 10% of their birth weight in the first 7 days of their lives. In a healthy baby, This weight will be regained by the end of their second week. Infants who are born ill or premature may take longer to regain this weight. If an infant has passed the second week of life and it has not returned to or surpassed its birth weight, the family may need to seek lactation counseling or bring the infant in for further evaluation. Which of the following is a test for hip dysplasia in an infant? A. Faber test. B. Thomas test. C. Downy test. D. Apgar test. The answer is C. Downy test. An examiner can look for hip dysplasia in an infant using the Downy test. This is performed by placing the child supine, then flexing the hip and knee to 90 degrees. They would then gently abduct the leg while placing downward pressure on the greater trochanter. In a healthy joint, the hip will move freely. In hip dysplasia, there will be a feeling of a clunk as the femoral head is relocated into the acetabulum. The Apgar test, Thomas test, and Faber test all check for hip stability and injury in adult populations, rather than pediatric. A new mother is holding her infant just moments after delivery. After she is able to rest for a short time, she looks down and notices that her newborn is covered in fine, but fairly dark hair. This is on the infant's arms, legs, and back. She is startled and asks the nurse if this is a sign of any disorder. How should the nurse reply? A. This is abnormal, a hormone profile is required to rule out hormonal disorder. B. This is normal, it should be shed in a few days. C. This is a sign of a serious metabolic disorder. D. This may be normal, the child should be monitored. The answer is B. This is normal, it should be shed in a few days. Fine, downy hair, called lanigo, generally appears on the fetus around 5 months of gestation. It is often shed before birth, but some infants are born with this hair still intact. The hair is normally shed within the first 1 to 3 weeks of life. In most cases it is entirely normal and not a sign of hormone or metabolic disorder. A young couple presents to a clinic with a 7-year-old who has varicella, chickenpox. The child is not in any distress and the virus seems to be progressing normally. They are concerned, however, because one of them is currently pregnant with their second child. They are at 31 weeks of gestation. The carrying mother had chickenpox when she was 2 years old. They asked the nurse if they should be concerned for the health of the unborn child. Which of the following is the most appropriate response? A. There is no need for concern. B. Frequent hand washing is recommended to prevent passing of the viral load to the fetus. C. The mother should not be in contact with the 7-year-old till the last lesion is scabbed over. D. There is mild need for concern, fetal monitoring is recommended. The answer is A. There is no need for concern. As long as the carrying mother has had varicella, she will be able to pass the antibodies to the virus through the placenta to the unborn child. This will confer passive immunity to the fetus. This immunity lasts for the first few months after birth, so newborns delivered by mothers with immunity to varicella will remain immune for some time even after delivery. Increased immunity to this and other pathogens is conferred by breast milk, which contains maternal antibodies, mostly Ig. By 5 months of age, what change would be expected in an infant's weight? A. Triple. B. Increase by at least 70%. C. Increase by at least 50%. D. Double. The answer is D. Double. An infant would be expected to double its birth weight by 5 months. Some infants may double their birth weight by 3 to 4 months. An infant that has surpassed 5 months without approaching twice their birth weight may need to be evaluated for feeding difficulties or failure to thrive. At what time does molding, the elongation of the baby's head as it passes through the birth canal, resolve in a newborn? A. Less than 24 hours. B. 2 to 3 weeks. C. 10 to 14 days. D. 1 to 5 days. The answer is D. 1 to 5 days. Molding, or the elongation of the infant's head during labor and delivery, is a normal adaptation allowing the relatively large skull to traverse the narrow space of the birth canal. It generally resolves in 1 to 5 days.